Good morning. Welcome to Walking with Warburg. My name is Allison, and in January 2023, I was diagnosed with terminal breast cancer. If you haven't seen my other videos, I've done 3 different protocols, including the standard of care. And when I started a metabolic treatment, about 2.5 months later, my breast tumor disappeared. Is that evidence it works? I don't know. There's a correlation for sure. And after that, I ran out of my medication and I started seeing some progression again. So again, that was correlation. That brings us to protocol 4, which you've been waiting for. And I had really sad news, which is that I had waited months to have my medication back in stock. And when it did come in stock, I was in a huge hurry. And I had planned on taking 1.2 milligrams per kilogram of the glutamine inhibitor that I had run out of. And in my haste, kind of on that first dose, I accidentally did 1.3. At the time, I was super worried. I was like, oh, wow, that's a really high dose. Last time I did that, I got sick. Should I do it? Should I not? What do I do? In hindsight, really not a big deal at the end of the day in the overall milligrams. So I probably worried a little bit for nothing, but it's irrelevant because I did the 1.3 and I had 0 side effects. Prior to that, I was really comfortable at 1.1 milligram per kilogram, and that was going to be kind of my dose moving forward. But I wanted to hit it really hard in protocol 4. So I thought, I'll just go up to 1.2. But then I accidentally went up to 1.3, had no side effects. So then 3 days later, when I went to do my second dose, I did 1.3 again and nothing happened. So at that point, I'm like, that's weird. I wonder if this new supply ultimately has come from a different vendor or something, and maybe it's not as good. So I contacted my vendor, and they swore up and down that everything is the same. So then I went into my third dose, and I went to 1.4 milligrams per kilogram, and 0 side effects. Did 1.4 again, 0 side effects. I contacted my vendor again and was like, hey, something's not right. I got no resolution from him. And then I did 1.5, 0 side effects. And at that point, I had only purchased enough of my glutamine inhibitor to do 1 protocol because at the time I was paying $15 a milligram US dollars. And I'm in Canada. So that worked out to $21 a milligram. And I think based on my weight and having kind of planned doing 1.1 or 1.2, I just did whatever. It was like, $8,000 or something stupid like that. And then I didn't even have enough for dose 6, which I tried to do 6 doses in 1 protocol. But I didn't have enough because I had been escalating with no side effects. So that was really disappointing. And I never did get compensated or any kind of resolution to that. But it definitely taught me that I need to do my due diligence and I need to find third-party testing. And so that, has made me a lot more comfortable. And I hope to be able to offer that to other people soon. I'm still waiting on a few little details, but that would be really nice because I think there's a lot of people who ought to be making sure everything they're taking, especially in supplements and things like that, that they're pure and they are what they've been advertised to be, especially when you're paying. Although there is no need to pay that. I was just getting ripped off like a lot of other people. Anyway, at that point, I also decided, hey, that's crazy. I need to change vendors. And if I could become more self-sufficient, that is ideal. So it took me a few months, but come June, I was self-sufficient in terms of sourcing my own glutamine inhibitor and getting it tested, but through third party and things like that. And so that put me into protocol 5. Now, I still sort of count protocol 4. I mean, it happened. I think it was a total waste of time. I don't think there was any efficacy in there, but it is what it is. So right before protocol 5, I got another PET scan and it showed some progression in my bones. Another correlation, right? Not only that, but it felt pretty clear that the standard of care was no longer working. So end of June, I decided, okay, I've got to do this different. I just at that point was so financially traumatized, to put it kindly. And I had really been relying on my GoFundMe. Then I had been paying, someone just insane prices when really he was just taking advantage of many desperate people. And that's really sad. Anyway, protocol 5 came around and I just needed to save money. And I started putting on my thinking cap. And I knew taking a glutamine inhibitor, that type of substance, like many, are damaged in your stomach, right? So what I had heard is that about 50% of it is destroyed in your stomach acid. Glutamine and other glutamine analogs are actually absorbed in your small intestine. So when you take a glutamine inhibitor orally, 50% is destroyed in your stomach. Then it passes into your small intestine, and that's where it's absorbed. So if you've lost half before it even gets to your small intestine, it gets absorbed there, and then it goes through first pass metabolism, where it goes through your liver, and it loses a little bit more bioavailability there. By the time it's getting into your bloodstream, it's definitely less than 50% of the bioavailability. I wanted to save money and I wanted to make sure I was getting the potency. And I knew that if you take your glutamine inhibitor intravenously or subcutaneous, you're getting 100% bioavailability because you're just skipping first pass metabolism altogether. It's going straight into your bloodstream. So I started thinking about how I could work towards that. And I wasn't ready yet, but I did talk to a couple doctors about putting my glutamine inhibitor into an enteric coated capsule. So a lot of medications and supplements are coated. It means that the coating protects it from your stomach acids. And then when it drops into your small intestine, the pH changes because your stomach is way more acidic. When the pH changes, the coating dissolves. So that's a way to protect your medications from getting destroyed in your stomach, right? So I started protocol 5, putting my glutamine inhibitor into an enteric coated capsule. And I got so focused on thinking about the gastric emptying speed. So how long it takes for something to move from your stomach to your small intestines, right? So not the speed of from your stomach out the other end. That's the full digestive process, right? That's not what I needed. I needed to know the gastric emptying speed. So from stomach to small intestine. And the reason I was so concerned about the timing is because if I recall correctly, based on the very limited research of taking this glutamine inhibitor orally, the best guesstimate was that peak plasma concentration would be about 2 hours. And so I want it to be in the hyperbaric chamber at least an hour when I hit that peak plasma concentration. And here's my logic, right? You could poke holes in it all day. I'd actually appreciate it if you did, because definitely protocol 5 didn't work. But in my mind, okay, so peak plasma concentration is 2 hours. I decided I want it to be in the hyperbaric tank, hitting peak plasma concentration 1 hour into my dive. And that's because I could catch the rise and the fall And so even if I was off a little bit in calculating my gastric emptying speed and, when the glutamine inhibitor would start getting absorbed, I had some wiggle room, right? So I had decided that I should take my enteric coated pill an hour before hyperbaric. And pretty much that's what I did for most of protocol 5. I screwed up a couple times, just learning, right? Got to learn the hard way because there's just very few, there was like nobody really I could learn from at that point. So I took my morning meds like I usually do, right? So even though I didn't think my standard of care was working, and at that time that was my oncologist had me on a hormone therapy. So I would take that every morning. So an anastrozole, you have to take that every day, exact same time. I would take it in the morning. My doctor had me on metformin. I would take that religiously every morning. I also took some of my supplements. At the time, I can't even remember them all, but it's actually not that many. It was probably like berberine, D3K2, anyway. And then my doctor had me on metformin. So I took all my morning meds. I don't know what time I woke up, right? I've got it all tracked. And if you want really detailed information, go to my blog. In my blog, I have written almost like for protocol 5, I think I wrote down like dose by dose of like the timing of everything. And then what I actually document for researchers is completely different. The blog is like my verbal diarrhea, letting everyone know kind of how things go. And it was a way to hopefully teach other people and to keep my family and friends updated and anyone who wanted to follow me. Whereas I have a spreadsheet with like all the numbers, more of like raw data put aside. But anyway, go to my blog for all the nitty gritty details for protocol 5. But what I learned in protocol 5 was that something in my morning meds, which also included Effexor, slows down the gastric emptying speed, because on the first dose, even though it had been hours between my morning meds and my glutamine inhibitor, I ended up throwing up before getting in the tank. And not to be super gross in detail, but I was like flying down the highway, driving, and all of a sudden, like familiar nausea came over me. And I'm, of course, trying to hold this in because I'm driving, but I'm sprayed all over my dashboard and my steering wheel. Anyway, the only reason I'm telling you this is because this yellow, like bright yellow powder, like wet, obviously, powder was on my steering wheel. And so when I got to where I was going and cleaned up, thinking about this, and I'm like, I swear that was berberine. It was berberine. Like there's no doubt in my mind that berberine came up. But what I couldn't figure out was I had taken the morning meds, including my berberine, hours before I had taken my glutamine inhibitor. And I had calculated that my gastric emptying speed, so everything would move from my stomach to my small intestines in an hour. But now, if I just threw up and berberine came up and it's been hours, then I'm like, shoot, well, why? Like, that's not normal, especially on an empty stomach, to take hours for something to. And so I started thinking that maybe something in my morning meds actually slows down gastric emptying speed. And I've heard that many drugs do that. And I think when I looked it up, it was metformin and Effexor that can both have that side effect. So I realized in protocol 5 that, one, your gastric empty speed is variable, and I have to time my morning meds quite differently. So to make a long story short, protocol 5, I struggled with my glucose. I did a lot of experimenting with my glucose, actually, and at that point is where I decided I'm going to start really upping my animal fat and eating more frequently. And protocol 5. So then I took 2 weeks off and I went right into protocol 6. I pretty much did the exact same thing for protocol 6, except I think at that point I started taking my enteric coated capsule an hour and a half before hyperbaric. at the end of protocol 6, let me just look it up. And again, go to my blog for all of the details. But protocol 6 was in August. And I had my next PET scan booked for the end of August. And the PET scan showed further progression. So I was pretty disappointed. That had been 2 protocols where I thought I was going to have a really good chance of kind of proving the efficacy of my metabolic treatments, because I didn't believe my standard of care, the hormone therapy my oncologist had me on, was working anymore. So at the end of August, my oncologist said that the hormone therapy was no longer working and he wanted to put me on capecitabine, which is an oral chemotherapy. So although I had been thinking about the fact that one day the hormone therapy would stop working and that I would end up on a second-line treatment, which is chemotherapy, I still wanted a little bit of time to think about it. You know, chemotherapy, all conventional cancer treatments, in fact, are highly toxic, carcinogenic, and at a very minimum, mutilate your body. I don't think these are decisions we should take lightly. And I feel like oncology is one of those fields where, whether it's intended or not, oncologists put a huge amount of pressure on the patient to make decisions really quickly. I feel it's unnecessary. I don't think that people need to rush into decisions. And when I mean rush in, often patients are making a decision within minutes of being told their options. That is unreasonable. At no point do we think it's good to make decisions in that kind of haste, right? When you lose your job, they say, take some time, think about it. Or if you're getting married, you know, when you're buying a house, like all these major, somebody dies, all these major events in life, they often say, don't make a decision right after, right? Take your time, think about things. But all of a sudden, you're in a cancer clinic and your oncologist says, this is what I think we need to do. And patients will agree or disagree like right away. Nobody goes home, thinks about it for a week. Nobody goes home and thinks, you know. And I also feel like it should be the oncologist's responsibility to tell you to go home and think about it. I don't think a couple days makes a huge difference for most people, right? So I think that, and my oncologist is great. I'm not suggesting he doesn't give me time, but I've never heard anyone tell me that their oncologist has said to them, this is the next step. Take your time, go home, think about it. Let's connect again in a week. And if you have any more questions at that point, I can answer them and then we can move on. That's never happened that I'm aware of. It seems to be oncologists say, this is what your next line treatment is. And the patients go, okay. They haven't thought about it. They haven't asked too many questions. If they did ask questions, it's on the spot. So anyway, when my oncologist said, you should stop the hormone therapy because it's no longer working and I want you to do capecitabine, I said, okay. I had a whole bunch of questions and I said, I want to think about it. We also had a really good conversation about the possible consequences of taking a month to think about it. Now, I didn't actually need a month to think about it. I needed just a couple days. I was pretty sure, like 99% sure, that I would end up doing the capecitabine at some point. It was just a matter of kind of when. And all of a sudden, being officially taken off of the standard of care, even though it wasn't working for many months before that, kind of being in that official phase of not taking any conventional therapy, made me feel like if I could go hardcore on metabolic treatments for that month, then I would know better whether or not to do the capecitabine. Thanks for joining me, and I'll see you in the next videos.